Welcome to a series of short videos that the St George's Get Set for Surgery team are making to help patients who are waiting for their surgery during the current COVID pandemic. This is our Get Set for Surgery team. We're a team of multidisciplinary health professionals that are here to give you advice and information on how to prepare as best you can whilst you're waiting for your surgery. This is me. My name is Dr. Carolyn Johnston. I'm a consultant anaesthetist at St George's and I'm the clinical lead for the Get Set for Surgery programme. It's a really worrying time at the moment, waiting for your surgery, waiting for normal life to resume. There's a real risk that as people stop their normal activities, that your fitness could decline whilst you're waiting for your surgery. But these videos are here to tell you that you can make some simple steps to keep healthy, so when your surgery does eventually happen, you're fitter, and so therefore you'll make a better recovery. So what we're going to cover in these videos is not just about your physical health, it's about your psychological health and about helping you to make good preparations. I'm going to talk about an idea we call prehabilitation. That means taking some simple steps before your operation to aid your recovery. There are some other videos showing you what to expect before your surgery, on the day of surgery, and in your recovery afterwards. We have a video on preparing your mind for surgery, so being mentally prepared for what's to come, dealing with any anxieties you have during your surgery and afterwards. We have another video covering activity and exercise, helping you to be physically fitter and teaching you good breathing exercises before your operation, which is very important. And we also have a video from our dietitians talking about how you can help yourself to eat well before surgery so that you have all the nutrients and building blocks you need to help your physical recovery afterwards. So I'll start with a few questions. Do you know how many operations are carried out in the UK every year? We actually carry out nearly 10 million operations in the NHS every year, ranging from the simple and straightforward to the complex, emergency and planned operations. Do you know what proportion, what number of those patients might experience some sort of complication related to their operation? The number is in fact around 30%. That's nearly 1 in 3 of patients in the English NHS that experience some sort of complication after their surgery. This might be a simple complication such as some delayed wound healing or difficulty getting back to your normal activities, but could potentially be a serious complication like a chest infection or dysfunction of the kidneys or of some other organ that, when they're very serious, could be a threat to your life and certainly a threat to your recovery. So the most important thing to understand about your operation is that avoiding these complications is the key to your recovery. And that's what our focus is when we talk about prehabilitation. We want to avoid things like chest infections, blood clots, and of course, surgical complications specific to your surgery in order to help you make a good recovery and get back to your normal life again as quickly as possible after your surgery. That leads me on to my main topic for this short talk, which is prehabilitation. I really love this slide because it's got a runner who's about to start a race. And a helpful way to think about your operation is that you're about to undertake a race, you're about to undertake something that will be testing and strenuous on your body. And similarly to a runner running a race, if you're able to put in some preparations beforehand, some training if you like, then your chances of making a good recovery afterwards are going to be so much better. Major surgery is a huge stress on your body, which of course can lead to complications. When you're in the healing phase after your surgery, you're vulnerable to all sorts of complications whilst your body is trying to cope with the healing processes after your operation. And we know that improving your physical and your emotional health in the lead up to surgery can help to reduce the impact of this stress and this vulnerability to complications. And we know that it works. We've seen it elsewhere in the NHS and in our own hospital, that people who engage in similar projects to this, who follow the type of exercises and advice that we give, have got a 25% reduction in their chest infection rate. That's a really big reduction. And some people who engage in exercise programs and dietary programs before their surgery can even get home from hospital sooner. Your stay in hospital is likely to be shorter if you can improve your health before your surgery. So it's definitely worth it. So what we know is improving your physical activity levels, eating a healthier diet, and of course, stopping smoking will help you recover better after your surgery. And that is even if your surgery is very soon. Even a few days of increased activity can help, but obviously the longer you're able to follow this advice, the better your fitness will be, and so the better your recovery will be. But there are some other very simple steps you can take up in the run-up to your operation that will help you in your recovery. The first step I want to tell you about is taking a deep breath. So as we sit in our day-to-day lives, we sometimes yawn, we sometimes sigh, or we have a little cough, and that's keeping our lungs clear and open and helping air get right to the base of our lungs, which is healthy. After an operation, we don't do this so much. We don't take nice deep breaths, perhaps because we're sleepy or we're lying in bed, or perhaps you're a little bit sore. And so this causes reduction in the base of the lungs, in the volume of the base of the lungs, a little bit of collapse. We know that happens, lung collapse. And this leads to a risk of chest infection. So in order to prevent that, we want you to practice some deep breathing exercises. And you'll see these exercises in another one of our videos. And we want you to practice that ideally before your surgery, so you get some good practice and you know what it feels like. And then after your surgery, we want you to do these deep breathing exercises every 15 minutes or so for the first day, just once or twice every 15 minutes to keep your lungs nice and open and inflated and really reduce that risk of chest infection. My step 2 is 2 steps that you can take in advance of your operation that will help prevent complications. Brushing your teeth well on the morning of surgery helps to reduce your risk of chest infection. And that's because all of us have bugs that live in our mouth. These are perfectly normal, perfectly healthy. But after an operation, these normal bugs that live in everybody's mouth can cause a risk of chest infection. And we know from scientific evidence that you can reduce that risk by brushing your teeth well on the morning of surgery. Please don't worry that brushing your teeth is going to cause risks to your fasting status, to your nil by mouth status. Anaesthetists don't mind you brushing your teeth. In fact, we quite prefer it. And we certainly don't mind you if you accidentally swallow a little bit of toothpaste or a little bit of water. That's no risk to you. It's much better that you brush your teeth on the morning of surgery. Similar to brushing your teeth, showering well with just simple soap or shower gel on the morning of your surgery can reduce your risk of wound infections. That's because it ensures the skin is nice and clean before you go into your operation. It doesn't need to be a special antibacterial soap or anything like that. Simple soap will do just as good a job to reduce that risk of wound infection afterwards if you can have a shower on the morning of your operation. Step number 3 is sitting up, and preferably sitting out of bed when at all possible. You'll feel better if you get back into your normal clothes. You'll feel like you're on the road to recovery. So psychologically, getting out of your pajamas and into your normal clothes is very important. We have electric beds in the hospital that you can adjust the head tilt, and we'd like you to make sure that you're at least 30 to 45 degrees at all times. Being upright after your surgery will help you breathe better, and it'll stop anything from coming up and going down the wrong way, which also increases that risk of chest infection. And the last of my steps is perhaps the most important: to get moving. Mobilizing and getting out of bed after your surgery is the single most important thing you can do to aid your recovery. So as soon as you're feeling up to it, check with the nurses and see if you can sit out of bed, and then see if you can mobilize. Mobilizing after surgery helps to clear secretions from your lungs. It helps to improve your circulation in your arms and your legs, so reduce the risks of blood clots. And it helps to get your appetite up and going again, improves your gut function. So it's good for you in every way, and it also helps you feel better. We know that you might be a bit concerned about getting up and getting moving so soon after your surgery. You might be worried about being painful or causing damage to your stitches, but it's very safe and very important that you do get moving as soon as the nurses say it's okay for you to do that. Managing your pain is very important, and we will help you deal with it because it's important to us that you can move about well and you're not frightened to do so because you're in pain. We need you to have good pain relief so that you can take deep breaths and cough, that you can sit up comfortably, and that you can move about. There's no point in saying that you're pain-free as long as you lie in bed stiff as a board and nobody touches you. That's not going to help you recover. So you must tell the nurses on the ward if you need any extra painkillers. They will have a list of painkillers you can have if you need them. To make sure that you can take deep breaths, sit up comfortably, and move about. We have a lovely pain team in the hospital. We have consultant anaesthetists. We have dedicated pain relief nurses whose sole job it is to look after patients in pain in the hospital. So if your ward nurse is struggling, they have other people that they can call on to help. So please do ask for pain relief if you need it, because it's an important part of your recovery. So my take-home message to you. Remember to take nice deep breaths. Practice them before your operation and make sure you do them every 15 minutes on the day after your operation. On the morning of your operation, brush your teeth and shower. After your operation, sit up in bed, sit out of bed, get back into your normal clothes as quickly as possible because it will help you feel better. And lastly, when you feel able to do so, get moving. Even if it's just to the end of your bed and back, to get up and moving is the best thing you can do to aid your recovery. Thank you for your time in watching this video today. I hope you find it helpful. Good luck for your preparations for surgery from all the Get Set for Surgery team. If you have any other questions, please check out our other videos or the webpage, or you can ask your surgical team to get in touch with us. We will see you soon in St George's for your surgery and hopefully for a quick recovery.